Hello, welcome back to my YouTube channel, My Intuition. This is regarding the biology for engineers for non-computer science stream students, that is electronics and communication, electronic stream, mechanical stream, civil stream students. Okay, so a few videos already completed. Now I'll be completing the entire syllabus within 2-3 days. Okay, so this is called BBOK407. Now into the module 3, third topic, that is regarding heart. Please do subscribe to my YouTube channel, My Intuition 4865. So we'll start with the question, which is already is communicated to you. Develop a design for a pacemaker which address the heart related issues by utilizing the knowledge of the heart's electrical signal and common causes of blockages, which is connected to the course outcome 4 with revised Bloom's taxonomy level 3 and carrying 10 marks. The mark distribution is also communicated to you early. So based on that, I have prepared the study material which I am going to explain here. So designing a pacemaker which requires a very thorough understanding of the heart's, the electrical signal, and what are the common causes of the blood blockage. And a device which is we are making, it should be very accurate sense, and accurately it should sense, and it should respond to the irregular heart rhythms, and it should integrate with the heart's natural electric system, and ensure that patient is very safe. It is the operation is very reliable, and the materials are biocompatible, not creating any issue in our body system, biological system. So by addressing some of the aspects of related to heart, pacemaker can be effectively made. Already pacemakers are there, Okay, so for the improvement of that one, we need to understand what is the working of heart. So studying the heart, that you might have seen the ECG, you might have seen in the movies and all this type of movement. Whenever a heart patient is there, they are connected to that ECG signal, a continuous signal movement. Based on the signals, the doctor, the expert will say exactly what is happening. Okay, so the nature of that signal is exactly the same. The P QR system and the T and U, that will further repeats. That is how the heart actively function. That activation of the atria, that represents the P, activation of the ventricles, that represented by QRS, and the recovery wave, that is TU, and further again it repeats activation of atria. So a normal heartbeat, how it look, a fast heartbeat how it look, and a slow heartbeat how it look, and an irregular heartbeat how it look, that is represented based on this graph, and these signals one can easily identify. So this is the ECG waves and their relation to the heart nodes. Okay, so our question answer, explanation of ECG process, that is heart signaling, carrying 3 marks. We need to explain what is P wave, what is QRS complex, and what is T wave. P wave, that represents the atrial depolarization, what is in here, that depolarization. For the electrical signal, it originates in the SA node and spread across the atria, and it initiates the contraction of atria, pushing blood into the ventricles. That represents the P wave. Then the QRS complex, this one QRS, so this particular wave nature. Okay, so the QRS complex, it represents the ventricular depolarization, where the signal travel through the atrioventricular node, AV node. So through this node the signal is passing. Okay, so bundle of branches and Purkinje fiber, these are the through the different nodes, signal travels through these different nodes. It triggers the contraction of the ventricles and pumping blood into the lungs and the rest of the body. Okay, so that represents the QRS complex. Then comes the T wave. There is a interval there from a Q, called as QT interval. Okay, so after QT interval, the T wave comes, represents the ventricular repolarization, where the ventricles recover electrically and prepare for the next cycle. Indicative the relaxation phase of the ventricles, essential for the heart to refill with blood. Okay, so that is about P wave, QRS complex, as well as T wave that comes under the ECG process, which we say, or the electrical signaling in the heart. They are connected. Our heartbeat that is connected with the ECG, and through that ECG process we are telling what is happening. That is the ventricular atrial depolarization and the ventricular depolarization, that is explained. Even ventricular repolarization is explained with that. Now the causes of blood blockage, that is a disease. Okay, so some of the dead muscle, the shows the damaged or dead muscle which is caused by the, which causing the heart attack, or shows the coronary artery which is getting blocked with a plaque built up, or a blood clot in the passage of the blood, that also creates the so-called uh, heart attack. Okay, so the plaque buildup, how it is happening: accumulation of fatty deposit or cholesterol and other substances in the passage of the blood or the arteries, that is called plaque buildup, and that is mainly fat deposits. It narrows the, or it hardens the arteries, the passage of blood, reducing the blood flow and potentially leading to heart attack or the stroke. Or atherosclerosis, a condition which is characterized by thickening and stiffening of artery walls due to plaque buildup. It limits the elasticity of arteries, increasing the risk of blockages and the cardiovascular event, that is heart attack. Now the pacemakers are designed. So the pacemakers, we know it is implanted pacemakers are there, which has got along the wire connection, and there is a pulse generator which is put inside the heart to make the heart to pump as per the requirement. Okay, how does it work? That is also given here. Active fixation screw is there, or passive fixation hook is also there. That's how they are connecting to that one to our inside the heart. So representing the components of a pacemaker, which is given here. So this is a pulse generator. These are the leads, and the lead fixation variants are also mentioned. Okay, now steps to design a pacemaker addressing irregular heart rhythms. Understanding heart's electrical system is important. Analyze the patient's ECG to identify the specific type of arrhythmia. Focus on critical areas like the SA node or AV node and the bundle branches. During designing a pacemaker, include a pulse generator, leads, and the electrode are required. The pulse generator, it produces electric impulses. The leads transmit these impulses to the heart, and the electrodes deliver the impulses to the appropriate cardiac tissue where the impulse has to be given. Integration with the heart's electrical system incorporates sensors to detect the heart's electrical activity, allowing the pacemaker to respond appropriately to irregular rhythms. So sensors required connecting the blood rhythm to connect and tell what is happening there. Then where we reach there? Oh, suddenly. Okay. Okay. Now that is integration with the heart's electrical system. Ensuring reliability and patient safety. Use a reliable and long-lasting battery, potentially with rechargeable options wherever possible. Ensure all materials are they are having biocompatibility, so that our immune system will not respond to that. Include the inappropriate shocks and ensure that device can be programmed and adjusted externally. Okay, every time we cannot operate it, there should be some mechanism to operate the pacemaker from the external, through from the external devices. Advanced features: the pacemaker, it should adjust the pacing rate based on the patient's physical activity and metabolic needs. It's not on the sleeping condition or just a walking condition. Even a patient, if he runs accordingly, the required pace should be reached to the heart also. So incorporation of capabilities for remote monitoring to allow healthcare providers to track the device performance and the patient's conditions in real time. Once the pacemaker is inserted, a health healthcare provider, or the one who is monitoring should be able to see what exactly happening to the person, or whether the pacemaker is working or not. So remote monitoring is also required, because if something happens to the patient cannot do anything. The healthcare provider need to reach to the place and need to do the required assistance. So these are the different types of pacemaker insertion. Many different types of single chamber pacemakers, dual chambers, or even ventricular pacemakers. So different types of pacemakers, and how, where and are they connected, that is also represented here, just for a reference. Okay, so that's about this particular class video, that is on pacemakers, how pacemakers are made and how it is connected to the biological inspiration, or how it is working, not based on the inspiration, exactly how it is needed, how the heart is pumping, how the heart is producing the electrical signal. The same way the pacemaker also should produce the signal, so that the natural process of blood circulation, as well as the purification of the pumping and the purification of blood takes place in a proper way throughout the body, and proper oxygen and carbon dioxide transfer also happens. So that's about this particular class video. Hope you understood. Please do like and share my videos. Thank you.